This is Ankita Tripathi, working as an associate professor in IIMT College of Pharmacy. Today, in my video lecture, I'm going to discuss about hypertension and its hypertensive drug. Before proceeding to the exact topic, let's have an overview what an hypertension means. See, hypertension is a basic concept in which what happens when the blood travels along with an arteries and it exerts higher pressure due to the artery narrowing or vasoconstriction effects, XYG, whatever the reasons are. If the blood exerts higher pressure on the arteries wall, it creates an hypertension or it creates an increased blood pressure. Due to this heavy blood pressure or due to this high blood pressure, our heart needs to exert more pressure for exerting a pumping of the blood. This pressure is known as hypertension. And generally, hypertension is measured in the millimeters of mercury, that is what we call mm per hg, the mmHg. See, in general, the normal blood pressure is 120 by 80. According to WHO, it is 130 by 80, 140 by 90. All these comes under the category of normal blood pressure. Above this, with the ranging of 9, pre-hypertension, then again 9, then moderate hypertension, and more than 160, that is severe hypertension. Now, what is the pathophysiology of hypertension? What exact reason how hypertension is caused? See what happened. Let's have a RAS model to describe how hypertension occurs. Renin-angiotensin system is also known as renin-angiotensin-aldosterone system is also known as RAS. And what happens due to any of the reason, when there's a decrease or drop in blood pressure of renal, that is kidney, or when there's a fluid draw of or there's a decrease in fluid volume in the kidney, the pressure in the renal pressure decreases, due to which our kidney releases renin. This renin release and reaches to our blood. Meanwhile, liver release an enzyme known as angiotensinogen. The renin released from kidney binds with angiotensinogen and to form an hormone known as angiotensin 1. This hormone is generally unstable in nature. To activate it, we need to convert it into angiotensin 2. For that, our lungs release an enzyme known as ACE, that is angiotensin converting enzyme, which is released from our lungs. This enzyme reaches to angiotensin 1 and convert it to angiotensin 2. The angiotensin 2 is a prominent vasoconstrictor. As it reaches to the blood, it constricts the arteries and the veins, that is why it is known as vasoconstriction, and it decreases the size. As the size decreases, the pressure is increased. One another effect of angiotensin, that it reaches to adrenal cortex activated and asks them to release a hormone known as aldosterone. This hormone primarily act to retain the sodium and water concentration in our body. See, if sodium is increased, it causes plaque. Means it get absorbed in the wall of the arteries and causes a plaque formation, due to which the arteries can get blocked. Due to the blockage of arteries, sometimes it happens, it can be collapsed, or maximum times it increases the pressure. Another, if water is get retained in our body will cess. This is how the mechanism of RAS work. Now, coming to the exact topic, what is antihypertensive drugs? Antihypertensive drugs are those drugs which control or which reduces the blood pressure, increased blood pressure or elevated blood pressures are known as hypertension drugs. On the basis of RAS, on the basis of sympathetic nervous system, our drugs have been classified into 3 of the categories. First are diuretics. Diuretics category, what does it do? It increases the urine formation, or it increases the urine flow from our body, due to which the sodium retained in our body releases up. Sodium and water from the body it releases up. That is how it works. It is divided into 3 categories: thiazide, high ceiling, potassium sparing. Thiazides, it has hydrochlorothiazide, chlorothione, and amphetamide. High ceiling, that we have furosemide with it, potassium sparing, that is spironolactone and amlodipine. Now, coming to the RAS classification, angiotensin-aldosterone system inhibitors, we have ACE inhibitor with us, that is captopril, enalapril, ramipril, isnopril, ramipil, etc. Coming to angiotensin AT1 receptor blocker, we have losartan, candesartan, valsartan, telmisartan, then olmesartan. Coming to renin inhibitor directly, that is elsclarin. Now, coming to the sympathetic nervous system, the sympathetic nervous system blocker, the inhibitors, we have adrenergic or beta adrenergic receptor blockers, which works on beta-1 receptor, that is propranolol, metoprolol, atenolol. Now, alpha plus beta blockers, we have labetalol and carvedilol. Now, last, that is alpha adrenergic blockers, we have parajosin, terajosin, joxajosin, and directly who acts on sympatholatic, that's scoladine and methyl-dopa. This flowchart exactly classify how our drugs work and at what mechanism they are going to work on hypertension. Now, coming to the sympatholytics. Sympathomimetic inhibitors are generally known as sympatholytics drugs. See, here is we are talking about MOA of, that is mode of mechanism of beta blockers. In beta blockers, primarily, we have like basically we talks about beta 2 blockers, that is beta 1 receptor and beta 2 receptor blockers. When it's coming to the hypertension, we need to talk about the beta 1. Generally, beta 1 receptor is present on the blood vessel. See what happens when beta blockers binds and inhibit the in the binding of with beta 1 blockers. It decreases the GPCR mechanism, due to which how GPCR decreases, it decreases the camp level, and due to which the heart rate, cardiac volume, all that decreases. Ultimately, the cardiac output decreases. What it causes? It causes the decrease in blood pressure. When the blood volume or cardiac output decreases, we have lesser blood to travel across the heart. So ultimately, when we have a lesser blood to travel, we exert a less pressure. So how this beta blockers decreases the elevated blood pressure. Second is diuretics. As I told earlier, diuretics work on the principle that to increase the volume or formation of a urine and help to exert them out from the body or expel out from the body. First, we have thiazides with us. Thiazides generally what they do, they reaches and bind with distal tubule. They bind and block the NaCl co-transport system. What is system? It reabsorb, it resend back. Then it and it blocks and binds co-transportation of sodium chloride, to which it helps in excretion of sodium from the body. If the sodium will excrete out from the body, the plaque formation will decrease, the narrowing of the artery will be decreased, and ultimately our blood pressure will also decrease. Now, coming to the second diuretic, that is furosemide. Furosemides also works like it binds and it binds on loop on hell. That is why it's also known as loop diuretics. It generally binds sodium, potassium, and chlorine symport, which is present on the loop of Henle. It also increases the excretion of sodium and water by blocking the retention of sodium and water in it, and it increases the urine flow. This is how diuretics help in excreting the sodium and water molecules from our body, so that the elevated blood pressure can be minimized. Now, coming to the RAS system, now we have a MOA, that is mode of action of ACE inhibitors. ACE inhibitor generally works for the conversion of 81, that is angiotensin to 82. If the conversion inhibits, the entire RAS system will not work. So what it does, ACE inhibitor generally binds to the ACB enzymes and inhibit their action, due to which the conversion of angiotensin 1 with 2 is inhibited, due to which our vasoconstriction does not happen, aldosterone release inhibited, and ultimately sodium water retention is inhibited, and ultimately what happens, BP decreases. This is how the ACE inhibitors work. ACE inhibitors generally works on the enzyme ACE. It inhibits their action and also inhibit the conversion of 81 into 82, ultimately which the elevated blood pressure is decreases. Now, coming to the third point, that is mode of action of ARBs, that is angiotensin second receptor blocker. What it happens, once the conversion has been done, once the angiotensin 1 with the help of ACE enzyme converted to angiotensin, it binds on its receptor and activate the release of aldosterone. Apart from that, it also helps in vasoconstriction. What we need to do, if we have to minimize the elevation of the blood pressure, we need to block them. The ARBs drugs, what they do, they bind and block with the AR82 receptors, on which angiotensin second cannot bind, and it doesn't causes vasoconstriction. Due to non-acclimation of a vasoconstriction, ultimately our arteries becomes normal and the blood pressure does not increases. Apart from that, ARB also helps in, like, see, when angiotensin second will not combine with its receptor, the aldosterone release will also be inhibited. Due to aldosterone release, the sodium water retention will be inhibited. Ultimately, elevated blood pressure will be decreased. This is how ARB drugs work. Now coming to the mode of action of aldosterone antagonist. See, as we all know that aldosterone is a hormone which is released from the adrenal cortex. It is released in the presence of angiotensin second. If due to any reason we are not able to like minimize all the above processes, we can control our BP by like blocking or inhibiting or antagonizing the effect of aldosterone. Aldosterone antagonist, what does it? It inhibit the release of aldosterone, or in short we can say it antagonizes the effect of aldosterone by blocking them. And ultimately what happens when aldosterone will not bind with its receptor or will not like work, what is the sodium water retention will be prevented, due to which the narrowing of the artery or the blockage of artery will be prevented, and ultimately the blood pressure will be minimized. This is how an aldosterone antagonist work. Now coming to the one of the last topic, that is alpha blockers. Alpha blockers is also known as sympatholytic drugs. It works as a position of sympathomimetic drugs. What happens? Alpha blockers bind and block alpha 1 or alpha 2 receptor. Generally we are talking about alpha 1 receptor. Alpha 2 drugs binds and block alpha 1 receptor, due to which direct cholinergic effects is shown on the body, and vasoconstriction has been prevented. Ultimately the vessels got dilated and blood pressure is minimized. This is how our alpha blockers work. Coming to the last topic of the lecture, that is renin inhibitors. As we all know, the RAS system has been started from the renin only. If we prevent the renin release, the entire renin system or entire RAS system will not work. This is how the blood pressure will not be elevated. So the primary work what we need to think about, or we need to do, just to inhibit renin. Renin can be inhibited. See, what's the renin work? Just have a recall. What renin do? Renin, when the renal blood pressure it decreases, kidney releases renin, and renin binds with angiotensinogen and convert it to angiotensin 1. From angiotensin 1, in the entire RAS system starts. Esclarin, that the drug which binds renin, which inhibits renin, binds with the renin receptors, or with the renin, it will stop the conversion, or it stop the binding of renin with angiotensin 1, due to which angiotensin 1 will not form. If angiotensin will not form, it will not convert to angiotensin second, and then aldosterone release will be inhibited, and ultimately vasoconstriction and retention of sodium water will be reduced. This is how, if we block the renin release only from the kidney, or if it is released, or if we bind it, or we inhibit its binding with angiotensinogen enzyme, ultimately we can stop our blood pressure to increase. This is how this mechanism works. For further query, you can take admission in IIMT College of Pharmacy. Thank you, and have a good day.